New at 10, the state health department is monitoring a rise in COVID cases across the state. Yet many people are finding this year's vaccine rollout more frustrating and confusing than ever, with changes to who is eligible and how much it may cost you. KTVU's Betty Yu joins us live in studio with more on what you need to know. Betty?
Claudine, COVID cases are climbing again just as we head into fall, but this year, getting your updated shot might be more complicated than expected, and a lot of people are left wondering whether they're eligible. Ever since Robert F. Kennedy Jr., a longtime vaccine skeptic, was appointed Secretary of Health and Human Services, public health experts say his policies have created confusion and now limited access to COVID vaccines. It's left federal agencies like the CDC in a state of limbo. Dr. Peter Chin-Hong is an infectious disease specialist at UCSF.
It's confusing to a lot of people because there are several things. First of all, usually every year when the FDA gives the approval for the new shot, the CDC gives it like their approval like a day or two later. So it's very hand in step. This year, there's a big difference between when the FDA approved it to the CDC is not meeting till September 18th. And that's leading to not California, but about 16 states where people need prescriptions, even if you're 65 and older, to get it.
Last month, the FDA approved updated COVID shots for the 2025-26 season, but only for specific groups. Right now, seniors over 65 can get the shot at pharmacies, and it should be covered by insurance. Adults under 65 must attest to having an underlying condition like asthma or diabetes to book an appointment, something we saw firsthand while navigating pharmacy websites like Walgreens.
I really wish that anyone who wanted one or needed one could get the COVID vaccine, especially because people still get long COVID, people still have complications, and just because you don't have an underlying condition doesn't mean that COVID would not make you really sick. In addition, if we're not able to vaccinate everyone, you're not going to get the herd immunity that you would like to get anyway.
Dr. Chin-Hong says that while case numbers are clearly rising, hospitalizations remain relatively low for now.
COVID can be deadly, as you know, particularly for the young and the older, so I'm aware of that. So it's still confusion. I do keep myself abreast of what's going on locally, with our governor, as well as with the Department of Health.
And the CDC's advisory panel again is expected to meet September 18th to vote on official recommendations. That decision will directly impact whether insurance companies and federal programs will cover the updated shots. Alex?
Yes, I imagine that is obviously very important 10 days from now, because I have read that shot will be anywhere from $150 to $200 if insurance does not cover it.
That's right. So it certainly could be a barrier to access for many, many people.
All right, Betty Yu will continue to follow it. Thanks so much.